You can start.
Hello,
Hello.
this is Dr. Ghabra, one of the exam candidates. Are you Mr. Smith, 45-year-old?
Yes, Doctor, I am.
Uh, I have been asked to ask you some question regarding your medical condition. During my conversation, I will write some notes. Is that okay? It will be confidential. Is that okay with you?
Okay, Doctor, I have no problem with that.
Well, I understand that you come here with some pain in your stomach. Is that correct?
Yes, Doctor.
Can you tell me more about it, please?
Yes, Doctor. For last few years, I had this type of pain, and that wasn't something severe. And after I felt that pain, I visited my GP, and he prescribed some lansoprazole tablet, and I took it on daily. But for the last 3 months, I noticed that the pain is mostly constant, and sometimes it is present mostly after taking food, and after eating, it becomes somewhat feeling discomfort, and for me, and that is making me anxious. And also, I think that I have lost my appetite. So I visited
I'm
my
sorry about.
GP,
mm,
and he sent me here for better evaluation.
I'm sorry about that. I will try to help you at the end of conversation. Regarding this pain, is it the first time or there is another history before?
Yes, doctor, I have this for about last 4 years, but this time it is present more constantly, and mostly after taking food. But previously, it sometimes came and go, and after taking the some lansoprazole tablet, it went away. But this time, it is not helping me so much.
And can I know where is the pain exactly?
It's on my. It is truly speaking, it is behind my somewhat back of my chest.
So it's not in the top of your abdomen, it's in your chest.
Yes, mostly back of my chest, and some part of my tongue, upper tongue.
And you said when it started exactly?
About 3 months back. But
Three
this type
months
of
back.
pain is present for 4 years. And for
And
2 months,
how it
it was-
progressed during this time? Is it getting better or progressing?
I think it is somewhat getting worse.
Getting worse. I'm sorry about that. You said there is pain. If you score the pain from 0, there is no pain to the 10, which is the maximum. How much you give this pain?
I will tell it about 4 out of 10. It's not so severe, but it is bothering.
I'm sorry about that. Can I know the type of pain exactly? Is it something crushing or like a knife or acidity? Can you describe it?
Uh, I feel somewhat heaviness, just like that, and some uncomfort, discomfort, like that.
And can I know what you do when you have this pain?
Okay, doctor. Actually, lying down brings this pain more, and if I sit down, I feel somewhat better.
Yes. And is there any relation with the food?
Yes, doctor. After taking food, I feel much discomfort.
Any type of food?
No, not a certain type.
Which type?
Not certain type. All type of foods.
All the same. Do
Yes.
you feel the food stuck in your stomach or in your food body?
Yes, doctor. That is another problem. That is also I also feel like that.
And what do you do for that? Is it improving by drinking water or changing position?
Sitting down makes me somewhat feel better.
Hmm. And the pain radiating anywhere in your body?
No,
Not going to the back or to the shoulder?
no,
Do you have any acid feeling in your chest?
not this time.
But usually you have this
Yes,
type
doctor.
of.
I had this type of problem, and for that I took lansoprazole tablets.
Mm. Do you feel nauseated or you want to vomit? Do you feel sick?
No, but about 2 times after vomiting, I felt better.
Mm. So is it frequent, the vomiting?
No, I don't do it.
And what is the content of vomiting?
Sometimes some undigested food particles, and sometimes even the foods that I have taken even one day before.
Did you have any history of vomiting of blood,
No,
throwing up blood?
no,
Uh, do you have any time that when you swallow there is pain?
no, no pain.
Mm, okay. And you said sometime you feel the food stucking in your stomach.
Yes,
Since when this history?
for last 3 months.
The same.
Yes,
And is it for all type of feeding or for solid only or water only?
I think it is more with the solid.
And it is the same until now, or it progress? It become for water also.
I think it is little bit progressed.
Mm, okay, I'm sorry about that. Do you have any chest pain?
No, except this I
Uh,
don't have any other pain.
do you have any sweating?
No,
Any shortness of breath?
no,
Racing or pacing of your heart?
no.
Okay. As I understand, you lose some weight, right?
Yes, doctor, and that is I
How
think
much?
it is not so much. I think about 3 kg over the last 3 months. Actually, doctor,
And
I feel that food is stuck in my food pipe, so that I try to take less food nowadays.
uh, how's your appetite?
Appetite is some reduced, doctor. And I try to eat less this time also.
Yeah, because you're afraid of food, you have
Yes,
reduced intake,
yes, doctor.
but the appetite is fine.
Yes.
Mm, okay. And the reduction in the weight, is it planning or not
No, I
planning?
didn't plan for it.
Intentional or
It is unintentional. Intentional.
unintentional? Yes. Uh, do you have any fever, any raised temperature?
No,
Uh, do you have any lump or bump in your body?
no,
Do you have any weather preference?
no,
Do you have any skin rash in any
no,
side of your body? Any swelling in front of your neck?
no.
Okay. I will ask you some more question about other system. It's maybe you feel not related to your complaint, but it helped me with the diagnosis. Do you have any headache?
No,
Any fainting,
no,
seizure,
no,
any numbness in any part of your body?
no, doctor.
Do you have how's your bowel motion? Bowel work?
I think it is good.
So there is no reduce bowel motion or increase, no diarrhea, no constipation.
No, not so significant.
Okay, how's your water work?
It's fine.
No problem. Any falseness in your urine?
No,
Any history of renal stone?
no.
Uh, what do you do for living?
I'm a school teacher. 10
Okay, is it
minutes per.
affecting your lifestyle?
No, doctor, it is just some worrisome, not affecting my life so much.
I, I'm sorry about that. Can I know if you have any past medical history, any condition before?
No, I was a totally fine and healthy person before.
So aside from this problem, you have no problem.
No,
Any medication you are taking aside from lansoprazole?
no, doctor.
Do you have any allergy to medication?
No,
Any allergy to food?
no,
Any hospitalization before?
no,
Any surgery?
no,
Can I ask you if any family history of similar condition?
no, doctor. I don't know any.
Any family history of cancer?
No,
Any family history of cardiac problem or sudden death?
no.
Mr. Smith, do you smoke?
Yes, doctor. That is a problem.
How how many cigarettes for how long?
About 15 to 20 sticks per day for about last 20 years.
You know, smoking is injurious for your health. I advise you to stop smoking, and if you want, I refer you to the smoking cessation clinic. Is that okay with you?
Okay, doctor, that will be very helpful for me.
Okay. Do you drink alcohol?
Yes, doctor.
How many?
About one pint a week.
Is it including weekend?
Yes, doctor.
Okay. Uh, any recent travel?
No,
Uh, Mr. Do you have any concern for me so far?
doctor, am I having cancer? Because I have heard that cancer patient present this way, like losing weight and pain in their tummy.
Uh, Mr. Smith, I'm sorry to tell you that the cancer is one of the differential diagnosis and it should be ruled out. But nothing confirmed till now. We need to take more detailed history and examination and investigation, and we will do camera tests for you, and maybe we need to take bees from your stomach or food buy, and after that we can exclude the cancer. But I'm sorry, it's one of the differential. It's one of the possibility.
Okay, doctor,
Any more concern you have?
doctor, do I need urgent any investigation or urgent any treatment?
Come again, please.
Do I need any urgent investigation or urgent treatment?
Yes, of course. We need to do investigation for you. It's including sample from your blood and camera test to your food buy, and maybe we need to take a piece from your stomach and food buy and send it for analysis.
Okay, doctor.
And we will continue for you, and maybe we change the lansoprazole to other type uh, of medication. It help you to improve symptoms. And I will refer you to the group of specialists, including uh, bowel doctor and specialized nurse, and they will follow up with you, study your investigation, and we will meet you again to finalize the diagnosis and the plan of treatment. Any more concern you are having?
No, doctor, that's fine.
I forgot to tell you, to ask you, do you have any pallor? Anyone tell you that you look pale more than before?
No,
Do you have any change in your bowel color? It become turned to black or black
no,
berry? So let me summarize for you, Mr. Smith, 45-year-old. You
You can
you
examine
come.
this time. You can examine in this
Sorry,
time. You can examine in this time. I think you're going. You're running out of time.
examine. It's station 5 or station 2?
For station two history taking, you have examination part for that.
I thought it's a history station, not 5. Okay, Mr. Smith, I would like to examine you. Is that okay for you?
Okay.
Okay, I will start examination by general looking. Look for pallor, jaundice, general condition. Is he looking well or no? Will look for muscle wasting in the hand and arm and other part of the body. Is there anything from this?
No.
I will examine for lymphadenopathy.
No
Any
lymphadenopathy.
lymphadenopathy.
No cervical
I will
lymphadenopathy.
I will check this the abdomen examination. Is there uh, anything in the general condition in the inspection? Any mass looking or change in the abdomen?
No.
Any organomegaly, splenomegaly, or hepatomegaly, or mass in the epigastric area?
No.
No ascites.
No.
I will examine the chest if there is any evidence of pleural effusion.
No.
Okay. Okay, anything else?
You have 2 minutes remaining.
So let's summarize, Mr. Smith. You, 45-year-old, came with complaint with the epigastric pain. It started 3 months ago. The epigastric pain, like heaviness in the abdomen and chest, it increased by food and by position and relieved uh, by laying down. There is no specific radiation. There is no pallor or jaundice. And Mr. Smith mentioned also decrease in the weight, like 3 kg. There is also history of difficulty in swallowing and the food sticking in the middle of the esophagus. It's more for solid. There is history, previous history also of acid feeling in the chest and epigastric area. There is no specific past medical history. The medication history only lansoprazole. There is anything else you want to add, Mr. Smith?
No. This is all I have.
Okay, thank you very much.
Thank you. You have still 1 minute.
Do you drive, Mr. Smith?
Yes.
Are you supported financially?
Yes, doctor. I think I am.
Any more concern you have?
No, doctor. You have explained everything well.
Okay, that's all. I don't have anything more.
Okay, time up. So, what do you think your diagnosis for this case?
So I have a list of differential diagnosis. It could be peptic ulcer, it could be dyspepsia, and gastric cancer should be ruled out. And regarding the history of chronic reflux, we need to rule out also is Barrett esophagus. We need to rule out Barrett esophagus.
Okay, do you have any other differentials?
Other differential could be we need to rule out ischemic heart disease, pancreatitis, gallbladder diseases.
Okay. Do you think that it can be case of achalasia, cardiac carcinoma, esophagus, Stricture esophagus?
Again, please, what do you mention?
Okay. Do you think it can be
Cardiac
case of
carcinoma?
achalasia, carcinoma of the esophagus, then stricture of esophagus?
Yeah, this Barrett esophagus, Barrett complicated by carcinoma.
Okay. So how will you investigate him?
I mentioned this one, Barrett. Investigation including the general in the blood, like white blood cell, RFT, LFT, electrolyte, coagulation profile, inflammatory marker, echocardiography to the abdomen, chest X-ray, and CT, chest, abdomen, and pelvis, camera test, endoscopy to roll out Barrett syndrome, Barrett esophagus, and to look for the stomach if there is any evidence of ulcer or abnormal growth.
Okay, that's fine. So how will you manage? Suppose this is a case of the esophagus.
Management patient need to be admitted for investigation, and it will be by MTT, multidisciplinary approach. You will be seen by GI doctor doing the investigation, and after confirming the diagnosis by biopsy, will refer for you said considering the case as carcinoma of the esophagus. After confirmation the diagnosis, the patient will be referred for oncology and chemotherapy and possible surgery operation. And patient, according to the stage of Barrett, also if it is early stage, maybe we can start with high dose BPI and follow up with endoscopy and biopsy.
Okay, thank you.
Thank you very much.